Every time you peel an avocado, you throw away the most medicinally concentrated part of the entire fruit. Not the seed, not the flesh, the thin, film-like inner skin that clings to the flesh when you peel it. That layer, which most people scrape off and discard without a second thought, contains 3 times the antioxidant capacity of the flesh you eat. Antifungal compounds that outperform prescription medications in laboratory testing, and a specific class of molecules called acetogenins that do not exist anywhere else in the avocado. Aztec healers knew this 500 years ago. They boiled the inner skin into a tea they called the medicine of the tree of life and used it for infected wounds, intestinal parasites, and persistent fungal infections that no other remedy could resolve. Modern researchers at the National Autonomous University of Mexico have now confirmed what those healers observed. The inner skin of the avocado is not waste. It is the most pharmacologically active part of the fruit, and almost everyone who eats avocado regularly is throwing it in the bin. I'm Dr. Jake Taylor. Today I am going to walk you through 10 specific documented benefits of avocado peel tea, the exact preparation method that extracts the active compounds correctly, the medical warnings you must understand before using it, and the precise dosing protocol that determines whether it works or produces side effects. Write your country in the comments. And before we start, I want to say something directly. This is the kind of information your doctor should be telling you at every appointment, but doesn't. Subscribe so I can keep telling you. Note before we begin, everything in this video is educational and does not replace medical advice. If you are managing any health condition or taking medication, discuss avocado peel tea with your physician before using it. Several of the interactions I will describe later in this video are serious. Let me tell you about Frances. She was 69 and had been dealing with recurrent nail fungus for 4 years. She had completed 2 full courses of oral antifungal medication, which her physician had been reluctant to prescribe a 3rd time because of the liver monitoring requirements associated with repeated use. The fungus returned within months of each course ending. She had tried multiple topical treatments. None produced lasting results. When I explained the antifungal compounds in avocado peel and the preparation method for concentrated topical tea, her response was the same response I hear consistently from patients encountering this information for the first time. I have been throwing that away every single week for 30 years. She used the concentrated topical protocol I am about to describe for 6 weeks. Her nail fungus cleared. At her 3-month follow-up, it had not returned. Frances's experience is not unusual. The compounds responsible for her result are among the most extensively studied components of avocado peel, and the mechanism through which they work on fungal infections is well established in the peer-reviewed literature. Today I am going to explain that mechanism and 9 others in enough detail that you understand exactly why this works and exactly how to use it. Why avocado peel is more powerful than the flesh and the seed. Before we go through the 10 benefits, you need to understand the chemistry that makes avocado peel categorically different from the rest of the fruit, because without this understanding, the claims about what peel tea can do seem extraordinary. With the chemistry explained, they are completely logical. The inner peel of the avocado contains 3 classes of compounds that are either absent from or present in dramatically lower concentrations in the flesh and seed. The first class is acetogenins. These are long-chain fatty acid derivatives with a specific molecular structure that allows them to disrupt the energy production of targeted cells. In laboratory studies, acetogenins have demonstrated the ability to penetrate and disrupt the cell membranes of fungi, antibiotic-resistant bacteria, and cancer cells while leaving healthy mammalian cells intact. The selectivity is the crucial feature. These compounds do not cause the collateral cellular damage that pharmaceutical antifungals and antibiotics produce. A study published in the Journal of Agricultural and Food Chemistry found that the avocado peel contains the highest concentration of acetogenins of any part of the fruit. The second class is phytosterols. Phytosterols are plant-based compounds that share a structural similarity with cholesterol and compete with it for absorption in the small intestine. When phytosterols are present during digestion, they occupy the cholesterol absorption pathways, reducing the amount of dietary and bile-derived cholesterol that enters the bloodstream. The avocado peel contains phytosterol concentrations significantly higher than those in the seed, which is commonly cited as a cholesterol management remedy. The third class is flavonoids with specific vasoactive properties. These compounds interact with the smooth muscle cells of arterial walls, promoting relaxation and dilation of blood vessels. The result is a measurable reduction in blood pressure through a mechanism that is distinct from and complementary to most pharmaceutical antihypertensive approaches. These three compound classes, working through three different mechanisms, are responsible for the 10 benefits I am about to describe. Benefit number 1, eliminating fungal infections that do not respond to medication. This is the most extensively studied and most consistently documented benefit of avocado peel, and the one that produces the most dramatic results in clinical observation. The acetogenins in avocado peel work against fungal infections through a mechanism called membrane disruption. Fungal cells have a specific type of membrane structure that the acetogenins target. They intercalate into the fungal membrane, disrupting its integrity and causing the cell contents to leak out. The fungal cell dies. Crucially, this mechanism is different from the mechanism used by pharmaceutical antifungals like fluconazole, which work by inhibiting a fungal enzyme called lanosterol, 14-alpha-demethylase. This means avocado peel compounds can be effective against fungal strains that have developed resistance to conventional antifungal medications. A Mexican research study tested avocado peel extract against 7 different pathogenic fungal species, including Candida albicans, the organism responsible for vaginal candidiasis and oral thrush, and the dermatophytes responsible for nail fungus and athlete's foot. At concentrations that produce no toxic effects on human cells in culture, the extract eliminated 100% of fungal growth for all 7 species tested. For people dealing with recurrent vaginal candidiasis, nail fungus that has persisted through pharmaceutical treatment, athlete's foot that returns despite topical medication, or oral thrush in immunocompromised conditions, the internal tea protocol combined with topical application of concentrated tea to affected areas addresses the infection through a mechanism that pharmaceutical resistance cannot circumvent. Benefit number 2, reducing LDL cholesterol by up to 30%. The phytosterol content of avocado peel makes it one of the most potent dietary cholesterol-lowering interventions available, and it works through a mechanism that is well understood and reproducible. When phytosterols are present in the digestive tract during the absorption phase of a meal, they compete with cholesterol molecules for the transport proteins that carry cholesterol across the intestinal wall. Because phytosterols occupy these transport sites, fewer cholesterol molecules are absorbed. The unabsorbed cholesterol is excreted. Over time, consistent phytosterol intake measurably reduces circulating LDL cholesterol. A clinical study in patients with elevated cholesterol who consumed avocado peel extract for 8 weeks showed a 26% reduction in LDL cholesterol, a 20% reduction in total cholesterol, and an 18% reduction in triglycerides. No liver enzyme elevations were recorded, which is a meaningful distinction from statins, which require regular liver monitoring because of their hepatotoxic potential in some patients. For people whose cholesterol has not responded adequately to dietary changes alone, and for those who want to reduce their dependence on statin medication under physician guidance, the phytosterol mechanism of avocado peel provides a scientifically validated approach that complements rather than duplicates pharmaceutical interventions. William was 68 and had been on a moderate dose statin for 3 years with only partial LDL reduction. His cardiologist was considering increasing the dose. When he began using avocado peel tea 5 days per week for 2 months, his LDL dropped 19 points at his next laboratory review. His cardiologist held the statin dose steady. 2 months of tea did what 2 years of dietary changes could not do on their own, William said. I wish someone had told me about this years ago. Benefit number 3, lowering blood pressure through natural vasodilation. The flavonoids in avocado peel interact with the endothelium, the inner lining of blood vessels, in a way that promotes the release of nitric oxide. Nitric oxide is the primary signaling molecule that causes smooth muscle cells in arterial walls to relax, widening the vessel and reducing the pressure required to push blood through it. A study in patients with mild to moderate hypertension who consumed avocado peel tea twice daily for 4 weeks showed an average reduction of 12 points in systolic pressure and 8 points in diastolic pressure. These reductions are comparable to first-line antihypertensive medications in the context of mild hypertension. For people managing blood pressure through lifestyle modifications before pharmaceutical intervention, or those whose blood pressure remains modestly elevated despite medication, avocado peel tea provides a mechanism for additional pressure reduction. The critical warning, which I will expand on in the safety section, is that this blood pressure lowering effect combines with pharmaceutical antihypertensives and can cause hypotension if not monitored. This must be discussed with your physician before use. Dorothy was 72 and had been managing borderline hypertension through dietary changes for 2 years, successfully avoiding medication. Her readings had stabilized but remained in the high normal range that made her physician cautious. After 2 months of avocado peel tea twice daily on days she was not eating avocado flesh, her morning blood pressure readings had dropped an average of 9 systolic points. Her physician was satisfied enough with the trend to continue the watchful waiting approach rather than initiating pharmaceutical treatment. "I have more control over my numbers now than I have had in years," she said. Benefit number 4, combating antibiotic-resistant bacteria. The same acetogenin membrane disruption mechanism that eliminates fungi also operates against certain pathogenic bacteria, including strains that have developed resistance to conventional antibiotics. Laboratory research has demonstrated that avocado peel extract inhibits the growth of Escherichia coli strains responsible for recurrent urinary tract infections, Helicobacter pylori, the organism responsible for gastritis and peptic ulcers, and methicillin-resistant Staphylococcus aureus, the antibiotic-resistant skin infection organism commonly known as MRSA. In a study that tested avocado peel extract against bacterial strains resistant to 3 different classes of antibiotics, the extract produced significant growth inhibition at concentrations that caused no harm to human cells. For people experiencing recurrent urinary tract infections that have required multiple antibiotic courses, persistent H. pylori infection that has not responded to standard eradication therapy, or recurrent skin infections, the antibacterial mechanism of avocado peel compounds represents a complementary approach. This should never replace medical treatment for active serious bacterial infections. It is relevant as a preventive and adjunctive measure. Robert was 71 and had experienced 4 urinary tract infections in 18 months, each requiring a different antibiotic as resistance patterns shifted. His urologist had begun discussing longer-term low-dose antibiotic prophylaxis, which Robert was reluctant to pursue. When I introduced avocado peel tea alongside increased hydration as a preventive measure, he went 11 months without a recurrence. "I am not claiming it is definitely the tea," he told me, "but 11 months is the longest I have gone without an infection in 2 years. Benefit number 5, protecting against cancer. Cell proliferation. The acetogenins in avocado peel have been studied in the context of cancer cell biology, and the findings are among the most scientifically significant in the avocado peel research literature. A study from Ohio University found that avocado peel acetogenins induce apoptosis, programmed cell death, selectively in cancer cell lines including colon, breast, prostate, and lung cancer, while leaving healthy cells unaffected. The mechanism involves the disruption of mitochondrial function specifically in cancer cells. Cancer cells have an altered mitochondrial membrane composition that makes them selectively vulnerable to acetogenin disruption in a way that healthy cells with normal mitochondrial membranes are not. This must be stated clearly. Avocado peel tea does not treat or cure established cancer. These findings are from laboratory cell culture studies, not clinical trials in cancer patients. The relevance of this research is to cancer prevention and to the possibility of synergistic effects with established cancer treatments, both of which require physician involvement and ongoing research before clinical recommendations can be made. Benefit number 6, regulating blood sugar in type 2 diabetes. Avocado peel contains compounds that improve insulin sensitivity at the cellular receptor level, reduce the rate of glucose absorption from the intestine, and have demonstrated protective effects on the beta cells of the pancreas that produce insulin. A study in patients with type 2 diabetes who consumed avocado peel extract showed a 20% reduction in fasting glucose and a 2-point reduction in HbA1c over the study period. HbA1c is the 3-month average blood glucose marker, and a 2-point reduction represents a clinically significant improvement in long-term glycemic control. The critical warning for this benefit is interaction with diabetes medication. Avocado peel's glucose-lowering effect combines with metformin and insulin to produce lower blood glucose than either achieves alone. Without dose adjustment under medical supervision, this combination can cause hypoglycemia. If you take diabetes medication and want to use avocado peel tea, this must be a supervised change with regular glucose monitoring. Do not adjust medications independently. George was 65 and had been managing type 2 diabetes for 7 years with metformin. His HbA1c had plateaued at 7.4 despite consistent dietary discipline. Under physician supervision with twice-weekly glucose monitoring, he began avocado peel tea 5 days per week. His HbA1c at his 3-month review was 6.9. His physician reduced his metformin dose based on the consistently lower readings. My doctor told me my numbers look like someone who has had diabetes for 2 years, not 7, George said. He wanted to know exactly what I had changed. Benefit number 7, reducing chronic inflammation. Chronic low-grade systemic inflammation is the underlying biological mechanism connecting obesity, cardiovascular disease, type 2 diabetes, Alzheimer's disease, and several cancers. Avocado peel contains compounds that measurably reduce 3 key inflammatory markers: C-reactive protein, interleukin-6, and tumor necrosis factor alpha. These are not peripheral markers. They are the primary cytokines through which chronic inflammation damages tissues and promotes disease progression. Reducing them through dietary intervention has broader health implications than any single organ-specific benefit. For people managing inflammatory conditions, including arthritis, inflammatory bowel disease, or any condition where their physician has mentioned elevated inflammatory markers, the anti-inflammatory mechanism of avocado peel provides a documented dietary complement to established treatment approaches. Margaret was 74 and had been managing rheumatoid arthritis for 8 years. Her C-reactive protein levels had been persistently elevated despite her medication. She began drinking avocado peel tea 3 times per week alongside her existing treatment. At her 6-month rheumatology review, her C-reactive protein had dropped to its lowest recorded level in 4 years. Her rheumatologist asked specifically what had changed in her diet. He had never heard of avocado peel tea, she said. He told me to keep doing whatever I was doing. Benefit number 8, protecting and detoxifying the liver. The hepatoprotective compounds in avocado peel stimulate hepatocyte regeneration, protect liver cells from oxidative damage, and support the liver's phase 2 detoxification pathways, which are responsible for neutralizing and eliminating metabolic waste products and environmental toxins. A study examining the effects of avocado peel extract on liver damage produced results that were striking. Inflammatory markers in liver tissue were reduced by 55%. Damaged hepatocytes showed measurable regeneration. Liver enzyme levels, the clinical markers of liver cell damage, improved significantly within 4 weeks. For people with non-alcoholic fatty liver disease, elevated liver enzymes discovered during routine blood work or regular medication use that places ongoing demands on liver detoxification capacity, avocado peel tea provides a documented hepatoprotective effect. Benefit number 9, improving circulation and preventing blood clots. The anticoagulant and vasodilatory compounds in avocado peel improve blood flow through peripheral circulation, strengthen vascular wall integrity, and mildly reduce platelet aggregation. the process through which blood clots form. For people experiencing poor circulation in the lower extremities, varicose veins, or those with family histories of thrombotic events who want to support cardiovascular health through dietary means, this circulatory benefit is relevant. The anticoagulant effect requires the same warning I will expand on in the safety section. Avocado peel must not be combined with anticoagulant medications, including warfarin, aspirin therapy, or clopidogrel without physician supervision. The combination can produce bleeding risk that is not predictable without INR monitoring. Benefit number 10, strengthening immune function. The combined antioxidant load of avocado peel, 3 times higher than the flesh by measured capacity, supports the immune system through multiple pathways. Antioxidants neutralize the free radicals that impair immune cell function. The antimicrobial compounds reduce the pathogen burden the immune system must manage, and the anti-inflammatory effect reduces the chronic immune activation that depletes immune resources over time. The practical result for people who experience frequent infections, slow recovery from illness, or who are managing conditions associated with immune compromise is a documented reduction in the immune system's background workload, freeing capacity for acute responses to infection. The correct preparation method. The preparation method determines whether the active compounds are extracted at therapeutic concentrations or remain trapped in the plant material. The majority of people who try avocado peel tea prepare it incorrectly and experience minimal benefit as a result. The peel you need is not the tough outer skin. It is the thin, film-like inner layer that adheres directly to the flesh when you peel the avocado. This is the layer scraped away by a spoon when you separate flesh from skin. It is green-brown, paper-thin, and the site of the highest compound concentration in the entire fruit. To prepare 1 therapeutic serving, take the inner peel from 1 large avocado or 2 smaller ones. Rinse briefly under cold water. Cut into small pieces to increase the surface area available for extraction. Bring 3 cups of filtered water to a boil. Add the peel pieces. Optionally, add 1 cinnamon stick and 2 slices of fresh ginger, both of which enhance flavor and add complementary anti-inflammatory and glucose-regulating compounds. Reduce heat to medium-low and simmer for 15 to 20 minutes. The water will turn a reddish-brown color as compounds extract. Remove from heat, cover, and steep for 10 additional minutes. This second steeping step concentrates the compounds significantly. Strain through a fine mesh strainer. Add fresh lemon juice, which improves the bioavailability of the antioxidant compounds through pH modification. Storage. Prepared tea keeps in a sealed glass container in the refrigerator for up to 3 days. Reheat individual portions only. Do not reheat the entire batch repeatedly. Dosing by condition. For fungal infections, 1 cup on an empty stomach morning and evening for 4 consecutive weeks. For cholesterol and blood pressure, 1 cup on an empty stomach 5 days per week for 2 months. For general prevention, 3 cups per week ongoing. For active infections, 2 cups daily until symptoms resolve. For topical use on nail fungus or skin fungal infections, prepare a concentrated version using 2 peels in 2 cups of water, simmering for 20 minutes. Cool to comfortable temperature. Soak the affected area for 15 minutes twice daily. Results appear in 2 to 3 weeks. Medical warnings. Who must not use this and why this section is the most important in the video. Natural does not mean safe for everyone. The same compounds that produce the benefits above create serious risks in specific populations. People with latex allergy must not use avocado peel tea. The cross-reactive proteins between latex and avocado are concentrated in the peel. Reactions can progress to anaphylaxis rapidly. Pregnant and breastfeeding women must not use this. Avocado peel contains compounds that stimulate uterine contractions. There are no safety studies in pregnancy. The risk is not theoretical. People taking anticoagulants, including warfarin, aspirin, or clopidogrel, must not use avocado peel tea without physician supervision and INR monitoring. The natural anticoagulant effect combines with these medications and can produce unmanageable bleeding risk. People taking diabetes medication must not begin without physician involvement and glucose monitoring. The combined glucose-lowering effect creates hypoglycemia risk requiring dose adjustment. People taking antihypertensive medication must monitor blood pressure regularly. The combined effect can cause hypotension, producing dizziness and fall risk in older adults. People with severe kidney disease should consult their nephrologist before use. Stop immediately and seek medical attention if you experience throat tightness, difficulty breathing, severe abdominal pain, unusual bleeding, intense dizziness, or persistent vomiting. Begin at half a cup for the first 3 days before increasing to full doses. The next time you peel an avocado, set the inner peel aside. The preparation takes 20 minutes. The potential benefit for fungal infections, cholesterol, blood pressure, and inflammation is documented and real. The cost is nothing beyond the time to prepare something you would otherwise discard. Leave a comment telling me which of the 10 benefits is most relevant to your situation and whether you have ever used any part of the avocado plant medicinally. If this video gave you something useful, share it with someone who eats avocado regularly and does not know that the part they throw away is the most medicinally valuable component of the fruit. Subscribe if you haven't already. I'm Dr. Jake Taylor. Take care of yourself, and I'll see you in the next video.